House Bill 1262 relates to the Governor's Interagency Coordinating Council on Health Disparities. The Health Disparities Council is charged with promoting coordination and communication between state agencies and communities of color to address health disparities. House Bill 1262 makes several changes to the Health Disparities Council with respect to its name and its membership and its responsibilities. First, the name is changed to the Governor's Council for Health Equity and Justice. Second, the membership is changed by adding representatives from the Governor's Committee on Disability Issues and Employment, the LGBTQ Commission, the Women's Commission, and a federally recognized tribe.
We do have Representative Tai to make an introduction. Please proceed.
Thank you, Mr. Chair. Thank you to the members of the committee. For the record, my name is Milin Tai, State Representative for the 41st Legislative District. There are certain populations in our communities that are being left behind. This is about inclusion. This is about seeing everyone in Washington deserving the services that they need. And we are open to hearing from the public and making sure that we will work on the piece of policy so it would meet the goal and the objectives serving every single Washington. Thank you.
We'll go ahead and move on to public testimony. We have several folks here ready to testify, and we'll move on to Blair. Please state your name for the committee record, and when you're ready, and please proceed. You have 2 minutes.
Hello, committee members. My name is Blair Daly, and I'm in Redmond. Washington Initiative for Boys and Men signed in as other on this bill because we're asking for an amendment that would designate a seat on our Health Disparities Council for someone who advocates for the health of boys and men. The bill currently assigns a council seat to someone who advocates for improved outcomes for women and girls, that is, a representative from the Women's Commission, and it gives a seat on the council to someone who advocates for improved outcomes for LGBTQ people, that is, a representative from the LGBTQ Commission. The bill doesn't designate a council seat for someone who's specifically focused on boys and men's health, which would be reasonable if there weren't health disparities affecting our male population. But there certainly are. Boys and men have higher rates of mortality in nearly every age group, higher rates of suicide deaths, and drug and alcohol-related deaths. Our health department estimates males born today will die 5 years earlier on average than their female peers. Working class men are particularly vulnerable to workplace injuries and chronic diseases. I could go on. The RCW for the Health Disparities Council, written back in 2006, says that it's the intent of the legislature to strive to eliminate health disparities between men and women. The bill before you now doesn't propose to change that language, nor should it. But this bill also doesn't include an advocate for the health of men and boys. It should. I encourage the committee members to look at the list of everyone who joined me in signing in as other on this bill. It's the King County Medical Society, the Washington State Urology Society, Laborers Local Union 242, the Growing Veterans Organization, and a dozen others. In summary, please include a place on this council for someone who advocates for boys and men's health. Thank you.
An amendment like what we requested was later introduced by Representative Joe Schmick, but over half of the members of the Healthcare and Wellness Committee voted no on it. The bill ended up passing out of the committee in its original version. It'll likely receive a vote on the House floor, which would be another opportunity to attempt to amend it.